What to expect when tapering off extended-release buprenorphine. In this telehealth visit, a doctor and patient discuss withdrawal and other helpful tips to keep in mind when discontinuing this medication.
Okay, so we've talked about some of the reasons you could discontinue your long-acting buprenorphine, some of the risks and benefits. What other questions do you have for me?
So yeah, how are we going to do this?
Sure. So stopping the long-acting injectable buprenorphine, that product that you're on right now, it should be relatively easy and easier than stopping the by-mouth version, the sublingual version of buprenorphine, because the injections provide a dose of medicine that gradually decreases over time, and it should give you a smooth off-ramp from the medicine.
Okay, so I should be able to stop the medicine right now.
That's the hope. That being said, this is a relatively new medication. We don't have a ton of experience with it, so we do have to look out for some withdrawal symptoms or cravings as you stop. So we'll have to revisit and make sure if things change, if we should provide maybe a lower dose of the shot or some doses of the sublingual version of buprenorphine to try to make the transition smoother.
Okay, and how am I going to feel if there is withdrawal?
Yeah, so the withdrawal you might experience will probably be similar to the withdrawal from opioids you've had in the past, hopefully much milder, but you could have some trouble sleeping, maybe irritability, might feel a little down and depressed, some diarrhea, or you might feel like achy and your whole body might hurt, like you have the flu. Those are all pretty common withdrawal symptoms. Also important to keep in mind that besides the withdrawal, you might start having some cravings, which could be from the medicine leaving your body, but it can also be from the psychological knowledge that, well, now there's no buprenorphine, I'm not taking buprenorphine anymore, I could go back to using and get high again. So that could cause some cravings.
Okay. Anything else I should know about?
Yeah, I mean, I think just to reemphasize that last point, it seems like it should be, we hope it'll be easy for you to stop the long-acting buprenorphine. It seems deceptively easy, maybe. You've been stable for a long time now. You might feel like, well, I'm good, I'm cured, but addiction is cunning, baffling, and powerful, to borrow a phrase from AA. We have to look at it as a chronic illness. So it's important to be really careful in maintaining your recovery. Realize you may not have had cravings for a long time while you're on the medicine, but they could return. And we should just try to think through and be prepared. If that happens, what's the game plan?
Okay, this sounds hard. How can I make this as seamless as possible?
So I think thinking about it beforehand, that like we're doing now, is an important part. And I'll let you know what some people try, which seems to work to help maintain your recovery even when you're coming off of medicine. So one important piece is to really have a good team behind you, some support people in your life who are available no matter, at any time of the day. If something happens, if a crisis comes up, you start having some cravings again, or you're questioning your choice to remain in recovery. So at least one or two people that are available, they can talk you through that and just get you through the tough time. Other people will just for themselves try to put things in place that, if I have a craving or feel overwhelmed, some inspirational messages, pictures of loved ones that are sort of reminding you why recovery is important. Maybe something to distract yourself if you have a problem, like a funny video or a movie. So all those things can be really useful just to have prepared, so that if something happens, hopefully it won't, but if it does, you'll have that to go to.
Okay, that makes sense. I heard about some people who thought they were okay in the past, but ended up, using again and overdosing. And I don't want that to happen to me.
Of course, and it's a pretty scary thing. It's definitely something we should talk over. One thing I want to emphasize on that topic is that when you stop using buprenorphine, your body very quickly goes back to its baseline for opioids. So you're pretty much back to the way you were before you started using. That makes you pretty high risk for an overdose if you go back to using opioids, even if you go back to using buprenorphine at a high dose. So you really can't assume that you can go back to the dose you took when you were actively using. If you do, it could cause an overdose and even death. So, just to be safe, and hopefully this will never happen, but if you do go back to using, make sure you use a small amount. Test it, give yourself a test dose just to make sure you know what your tolerance is at. It's probably it's going to be back to zero. So use a small amount. Also, it's good to have someone around with Narcan, naloxone. That's the drug that can reverse an overdose. Just for safety, you never know what's in the drug supply these days. There could be fentanyl, there could be carfentanil, or other really potent opioids. Even a small amount could be deadly. So having someone with naloxone available and to reverse an overdose could save your life. I'll write you a prescription. You can get a free kit from the clinic. Even if you never use it, it's good to have around. So make sure you have that on hand, and hopefully you'll never need it.
Okay, got it. Thanks, Doc.
Yeah. Okay. So I think we've talked about everything. Let's try this plan. We'll stop the injections for now. If any problems arise, if anything comes up, please reach out to us. Let the staff know. Call me. Try to let me know, and we'll revisit this plan if we need to. I'd rather find out earlier, that things are not going great, rather than after things have really not gone well. But hopefully that won't happen, and hopefully everything will go smoothly. And I'll see you at our next visit. Okay.
Okay. All right.
All right, very good. Take care.